let's jump into upper airway obstruction. Inspiratory stridor. I know that a lot of people, they kind of get those mixed up. They're like, expiratory stridor? Is it inspiratory stridor? Expiratory wheezes. If it is inspiratory, you must think upper airway. What we see right here is a universal choking sign. This dude's choking. We'll talk about relieving choking. Dysphagia, difficulty swallowing. Very good test question to know once they start throwing out terminology like that. What's the cause? There can be multiple causes of upper airway obstructions. Is it intrinsic? If it's intrinsic, it's something that's happening from within the body. For example, swelling. An intrinsic factor of upper airway obstruction could be the tongue. An extrinsic factor of upper airway obstruction could be choking on a hamburger. So please know the difference between intrinsic factors of choking and extrinsic factors of choking. What are we going to do? If my patient is conscious, remember, Heimlich maneuvers for adults and children, back slaps, chest thrusts for infants. All right. Let's talk about when that person goes unresponsive. First thing that you need to know, check. What do I mean by check? I mean, look in their damn mouth. Don't just jump right on CPR. If that's a test question and they say that the patient goes unresponsive and they have an option to look inside the mouth to grab it, dude, look in the mouth, check for it. So open the mouth. Do I see anything? No. Now I start chest compressions, 30 chest compressions. Then I attempt 2 breaths. What if my breaths don't go in? If my breaths don't go in, we still do readjustments. Readjust the head. Maybe it was user error. So we're going to readjust, reattempt. If breaths still don't go in, we go back to A. We're going to check. Is there something I can see that I can grab? I'm going right back into chest compressions. 30, reattempt the breaths. We're doing that over and over. So please know that CPR gets done when your patient is unresponsive with a foreign body airway obstruction. Do not do a Heimlich maneuver, or do not pick Heimlich maneuver or abdominal thrusts if your patient is unresponsive on an exam. FBAO with direct laryngoscopy. You're a paramedic. You're taking a paramedic test. We do not just do CPR and try to bag patients. Now understand this. If your test question, for example, says your patient goes unresponsive, I want you to BLS before ALS. I want you to still check, start chest compressions, attempt 2 breaths, do all that stuff. But if the test question tells you that you have a partner who is doing chest compressions for you, what the hell are you going to do? You can't just stand there and watch. We are going to grab our laryngoscope and our Magil forceps. Now, there's a couple different methods of using the Magil forceps. You're either going to use the Magils in the right or left hand. You're going to intubate and try to perform direct laryngoscopy exactly how you would for intubation. So if I'm using a Mac blade, I'm going to the vallecula. If I'm using a Miller blade, I'm going to try to grab that epiglottis, and I'm going to visually inspect that glottic opening and see if I can grab something.